Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Oxygen, hemoglobin, dissociation curve. So here the relationship is between the percent of the saturation and also the partial pressure, and this is nothing but of the oxygen in the arterial blood. So it is basically its sigmoidal shape. So sigmoidal curve is seen, shaped curve. It is due to the positive cooperativity, that is binding of one molecule. So binding of one molecule of the oxygen, and it facilitates. So it facilitates the binding of the next, and similarly the release of one O2 molecule promotes the release of the other. Then looking at the P50, it is a partial pressure of oxygen, the oxygen at which the hemoglobin is 50% saturated. 50% saturated, and in the arterial blood it is about 26 mmHg in venous blood, and in venous blood it is about 12. It is about 29. So in arterial blood 26, and venous blood about 29. So what are the effects of the oxygen hemoglobin curve? So when you look at the effects of oxygen hemoglobin curve, what is the effect on pH? On pH there is a right side shift. So there can be observed a right shift of the oxygen hemoglobin curve, and this is due to the decrease in pH. So there is decrease in pH and rise in the blood oxygen, rise in the blood CO2 partially. It is called as a Bohr effect. So the affinity of the hemoglobin for oxygen increases at the higher pH and decreases with the fall in pH. So decreases with fall in the pH. Next, there is something known as a double Bohr. So double Bohr effect. The double Bohr effect, it occurs in the placenta. Since the Bohr effect, it occurs in the maternal and the fetal tissue. Next, moving on to the 2,3-DPG. So 2,3-DPG, it is synthesized. It is synthesized in the RBC from metabolites. From the metabolites of the anaerobic glycolytic pathway, since the RBC lack the mitochondria. So it binds to the hemoglobin and it stabilizes what? The deoxy form. So deoxy form is stabilized and reduces the affinity of hemoglobin. So reduces the affinity of the hemoglobin and for the oxygen. So it reduces the affinity of hemoglobin to the oxygen, and it causes the release of oxygen as well as the production. So it results in the affinity of hemoglobin for oxygen, causing the release of oxygen and production of 2,3-DPG. So this production of 2,3-DPG, and this is stimulated by hypoxia. An example being the anemia and also the high altitude.